What is dementia? Is it age-related or age-associated? How do you diagnose dementia? What are the possible lifestyles that could possibly trigger dementia? Well, today I have an expert. I hear he's the best in the field, Adeshola Oguniyi. He's a professor of medicine, consultant neurologist, UCH Ibadan. He will be empowering us with information on dementia. You know, on this program, we empower you with information on issues, rights, privileges, and duty to enable you make informed choices, especially when you factor in something you heard on the UD factor into your situation. You're welcome. Don't go anywhere. We'll be right back. You're welcome back. Prof, thank you for coming all the way to come and empower us with information.
You're welcome.
I hear you're the best, but your modesty won't let you accept that. Prof, what is dementia? Is it age-related? Is it age-associated?
Both. Dementia is both age-related and age-associated.
Okay.
It means loss of mind, and is a clinical condition characterized by abnormal brain function, sufficient to disturb activities of daily living, while the person is conscious and alert. Now that's very important, because if the person is not conscious and alert, then it's another condition called delirium, which might require psychiatric attention.
Okay.
But dementia is something that occurs as people get older, so it's age-associated, and it's also related to getting old.
Okay. What are the common types of dementia, and what are the causes of dementia?
The most common type of dementia is called Alzheimer's disease.
Okay.
It was named after a German neuropathologist about 1906, and that's the commonest type all over the world. Then we have dementia associated with stroke, and that is called vascular dementia.
Okay.
Individuals who have Parkinson's disease can also develop dementia. There's a variant that we've described in our one elderly person in our cohort that we studied in Nigeria called Lewy body dementia, in which you have abnormal protein in the brain in that individual. Behaves almost like a Parkinson's disease dementia, but we can differentiate them. Then we have dementia associated with Huntington's disease. These are rare genetic disorders.
Yes.
But more importantly, we talk of treatable dementias. These are dementias that occur in association with metabolic derangement, endocrine disorders, infections of the brain. And that's the group that we actually look out for, because the goal of a doctor is to offer hope and to provide treatment. Yes. So you must treat these ones, because most of the other forms, there's really no established treatment for them.
Okay.
So
I would like to ask you, you're talking about the metabolic, the stroke, and are those ones age-associated, or just sickness that could happen to anybody, or they are all age-associated?
Now, the treatable dementias are not usually age-associated. Okay. They can occur in any individual once the brain injury or brain insult is sufficiently severe enough to impair ability of the brain to function well and to disturb day-to-day functioning. But the one associated with stroke can be age-related, because, as we know, stroke becomes more frequent as people get older. Yeah. But stroke can occur in very young individuals. Yeah. And if young individuals have stroke and then they have recurrent strokes, then they may then develop dementia.
What are the lifestyles that could possibly lead to dementia?
There are a few things that have been shown from studies. The first one is that if people live in isolation, it tends not to stimulate the brain sufficiently, and so they may be predisposed to dementia. At least some studies from here have pointed to that. Then some feel that individuals who drink a lot of alcohol might be at risk of developing dementia. Then the type of diet that individuals eat. Sometimes some of this lack of nutrients can affect the brain. Vitamin B12, for instance, thiamine, which is vitamin B1, and sometimes folic acid. There are things that, when they are in low quantity, can affect brain function. And so these are things we watch out for and we try to treat.
How do you diagnose dementia?
As I said before, it's a clinical condition. The individual with dementia probably will not come up to you, but it's the person who lives with the person who will have observed some changes.
Which I can add to another question. And what are the subtle warning signs too, along with that?
Yeah, I think we should start with the subtle warning signs.
Okay.
And depends on type of dementia. The most common one is forgetfulness. And it starts with individuals going to a room to pick something. And then you go there, and then you come back. You've forgotten what you went inside there for.
Doc, how can you say that? A lot of us, it happens to a lot of us, especially when we've crossed the 50.
I know. Now that's why dementia is the end of the spectrum. We have some other conditions that come in between. Those are the ones that are called age-associated memory impairment, mild cognitive impairment.
Menopausal sometimes.
Yes, then benign. They call these ones benign conditions because they're usually not due to severe insult in the brain, and individuals will get out of them, especially if you're not paying sufficient attention to what you're doing. And Yorubas have a saying that if you put something in the left hand,
you'll always not
remember where it is. I don't know how that originated,
yes.
But I think it's just because that the left hand is regarded as not to be used for many things important.
Okay.
So anytime you leave things in the left hand, then you may forget it. But it's happened even to the best of us. You go to a room, or sometimes you are holding your key, and you've forgotten that the key is in your hand, and you search all over the place.
And you keep pacing. Where did I leave this key? Yes.
But fortunately, you'll find the thing. Now, the person with dementia may not find it.
Okay.
And then it gets to a stage where they may start accusing other people of stealing their things. And that's when it becomes a problem, and they may become aggressive in such situations. So forgetfulness is the first thing.
Okay.
Then you can have difficulty in use of words. Now you're asking me things and I'm responding.
Yes.
Such individuals may find difficulty in using the right words. I may introduce new words, or they say things that people do not understand. Then another form is people getting lost, especially elderly people.
Yes.
And that's very common.
Very common.
They go to a community that they should be familiar with, and they may not be able to find their way back. And they just keep roaming, and people see them. And sometimes they may become victims of some miscreants who think they are wizards or witches, and sometimes they may stone them. And that's the bad part. This is called elderly abuse, and it's one of the things that we try to preach against. So loss of awareness in an otherwise familiar place is something that can be a mark of dementia. Then we have individuals who cannot use money well. And we've had cases in our clinic in which the relations come to say that the man is a trader, somebody buys something, and rather than giving the right change, they even give more on top of that. So that at the end of the day, the account does not balance. And because they are prone to such things, you'll find that many people will come and buy things from them because they know they'll get more money than they put in initially.
Hold the thought, Doc, hold the thought. Don't go anywhere. We'll be right back. You're welcome back. If you're just joining us, we're talking about dementia, and my guest is still Adeshola Oguneye, a professor of medicine, consultant neurologist, UCH Ibadan. I hear he's the best when it comes to dementia. Yes, Doc, we're just still talking about the warning signs of dementia and the causes of dementia. So you were enumerating some of them, yes.
So we usually have a long list. There's like a checklist that if somebody forgets things, does not use the right word, gets lost, misses how to spend money, does not take decision appropriately, and you check some of these things, then the person may be at risk of developing dementia and should be seen by a physician. Yeah. Of course, having all these problems will not amount to dementia. It becomes dementia when the person is unable to function well, and somebody then needs support, that somebody now needs somebody to take him or her out into the community, somebody needs to look after the finances, Somebody needs to take care of personal hygiene. Somebody needs to feed the person. Again, we can see that dementia is in stages. The mild form, then the moderate, and then the severe form. And it's when it's severe that the person really requires almost 24/7 kind of care. And that, at that stage, the person is believed or is said to be dehumanized because it behaves as if it's no longer a human being. They become a baby. So the other name for dementia would be like disease of old people in which they become children. That's the description of it. So the person is dehumanized. They pass urine, they don't feel they've done anything bad. They can't feed themselves. They just sit there mute, uncomprehending, and really a pity at that stage. So that's the problem.
Do we have that kind of situation in younger people ordinarily?
Ordinarily, we don't have it in younger people, except they have brain damage from some other reasons. So you may have some individuals who are born with some mental disturbance that can behave abnormally like that. Some do it out of habit. They just don't care about their personal hygiene. But commonly, we see this in elderly people, and that's when it's a concern.
Is there any, outside of the signs, when they come and they come accompanied and somebody now tells the doctor, this is happening, are there tests that can be run to determine
Yes.
Dementia or how far gone?
Yes, there are tests. We have various skills. And we've actually developed most of these because we started dementia work in 1991. That's about 25 years ago. And we developed screening instruments for dementia, and we have cutoffs. Now, like I said, these screening instruments will tell us individuals who have cognitive problems. You now have to match this with functional impairment. And even for that, we've developed special instruments for assessing activities of daily living that will be relevant for this environment. Everything has to be contextual with the environment, because if you're saying now use of cell phone is universal, but imagine when we started 1991, cell phones were not readily available. Use of microwaves and all that, they're not common. So you cannot ask elderly people if they can use microwave and all that. So it has to be contextual to social things they do in the communities. And so when in the communities they're unable to provide advice, they cannot meet with other colleagues, and they cannot look after themselves, then there's functional impairment. But more importantly, what we've noticed is that if an elderly person cannot handle money well, then there's a problem. And so we then flag them out and then ask them to be reviewed by a neurologist. After doing all these tests, you may then need to do other investigations, some blood tests and imaging of the brain, like doing a brain scan. Because it's not every time somebody behaves funny that is because of a degenerative disease in the brain. Sometimes it may be because of a stroke, which can cause dementia. It could also be because of a brain tumor. And so you can diagnose this. Sometimes elderly people can hit their head against the wall without being aware, just trivial injury. But then that can lead to a small clot that may then expand. This is called a subdural hematoma. And the elderly people behave so badly that they lose their mind. But if they make the right diagnosis and they take out the clot, neurosurgeons are very good at that. It's a mini procedure for most neurosurgeons. Once they take it out, the person is as right as rain, and they get back to their normal function. So that would be a part of a treatable dementia. If somebody has a brain tumor and they take out the tumor without much damage to the brain, then the person gets back. So when we've done all this, we've excluded treatable things, then we can then say that this is a degenerative disease and the person needs to be managed by an expert.
In that managing by an expert, medications are given and care is given.
Yes.
And they constantly have a need for somebody to be around them.
Yes.
I know that abroad, a place in, I think is it in Amsterdam or somewhere, they have a whole village where they have like a home for people who have dementia.
Yes.
Do we have, I think I watched it sometime on CNN or somewhere like that.
Yes.
And they had all kinds of amenities, fantastic homes.
Yes.
Do we have such homes here?
We haven't reached that stage yet. We have a few old people's homes, but you know that culturally it's not something people want to do. If you take your old folk to that kind of place and abandon the person, society judges you. It's a signal of destitution and that the person does not appreciate the older person. So they will chastise that family. So because of that, old people's homes are not very popular. But a few individuals and a few religious organizations are organizing old people's homes now. but we've not reached the level that we have overseas. The one in Amsterdam, I'm aware of. In England, you have a lot of old people's homes as well, and you have old age psychiatry. But it's a field that is slowly building up. But with time, such facilities will be necessary. And the reason for that is that most people go to work. And the extended family system is also breaking down. So you cannot depend on family members to come and sit to look after your old person. So you may have to then look for a crèche type of thing like we do for children. So take them there when you're coming back in the evening, you pick them up and take them home and look after them at home. It may get to that stage. But during the period where they're in that stage, you must keep them busy. We've developed a way of treating people with dementia. It's called cognitive stimulation therapy, in which individuals come together. You bring individuals who have dementia together in groups of about 8, and you take them through 2 sessions a week for about 7 weeks. And we've shown that that is very beneficial. And it's been written up for publication so that it's something that we think will be beneficial for caring for people with dementia. Such a procedure has reduced stress on caregivers and has improved some brain performance in those with mild and moderate dementia, but not in those with severe.
What are the lifestyles that, for those who haven't yet gotten to that stage of dementia, what are the lifestyles we should adopt? Don't answer that question, you'll answer when we come back. You're welcome back. If you're just joining us, well, the topic is dementia. Before we went on break, I asked you a question. What are the lifestyles we should adopt before we get to that age when dementia starts setting?
I think the first thing we should do is to keep the brain stimulated. Okay. I think constant stimulation of the brain helps to develop connections between brain cells. So reading helps. Using crossword puzzles, board games, all those things, and then interacting with individuals. Living in isolation is not good. Unfortunately, our own culture does not allow that.
But if you live in isolation and you can play all those games and still...
It will still not be sufficient. I think you still need a bit of contact with other individuals to keep the brain active and so that they can bring new dimensions to one's thoughts. But definitely that helps. We must eat well, whatever that means. That means do everything that will make the brain function well, provide the right nutrients. Some studies have shown that individuals who are malnourished in old age, who are very lean and all that, they are prone to dementia. So, but also some other studies have shown that individuals who are very obese are also at risk of dementia. So if we can be in between, I think that helps. Individuals who have hypertension should not use a lot of salt in their diet because we've shown that hypertension increases the risk of dementia. So people should avoid that. People should not eat a lot of fatty meals. We know that too much fat in the blood is also not good. So there are drugs that can help lower or reduce the level of cholesterol, which may be bad because it clogs the blood vessels. Things that will prevent stroke, we must also avoid. Then individuals must live well and sleep well and think well and avoid alcohol and reduce smoking. In fact, stop smoking as old age. And alcohol should be in moderation if it will be taken at all. It's always tough talking about alcohol in moderation because you never know.
You never know what moderation is. And some people will tell you that doctor has said if you can take a glass of wine and they use that opportunity to down a bottle of wine, it's good for your heart.
Yes, that's the problem. So you're always careful about what you recommend.
Yes.
But alcohol, smoking are things that we know that could be deleterious to the body. So they should be used with moderation in all situations. And then if somebody is sick, you should please see a doctor. Some of these illnesses that affect the brain might lead on to death of brain cells, which will result in dementia. So if there's prompt attention, then that will help. I think those are the things I would recommend for elderly people who may be at risk of developing dementia. And
caregiving can be very tough.
Yes.
People who have relations or parents who are suffering from dementia, that puts an added stress on them in being caregivers. What advice would you give to people who are caregivers at this time, to parents who are currently having dementia?
Well, I think they can form support groups. This kind of establishments have helped in other societies, South Africa, for instance, and in UK and co. So, and we did that also when we did our Ibadan study, in which we organized monthly meetings for caregivers. They come there, they discuss their problems with their colleagues, so the others also get informed. It also provides an avenue for escape, at least for that period when they're with us. They don't have the stress of looking after somebody, provided by the time they get back, nothing worse has happened to the person. Well, it really helps. And we also treat their illness. The usual saying is that it's the person who looks after the demented person who bears the burden of the illness. Because the person who is demented doesn't really know much anymore, especially in the severe stage. But the person looking after them is the one who is caring and doing everything. And they're prone to depression, they have hypertension, and they're very sick. So if there's a support group and they are treated, which was what we did during our Ibadan study, shown that this is beneficial. And so we recommend that. They could form support groups. They could discuss their problems. And they could also invite people to come and assist them so that they don't take the burden on themselves. They go alone. Involve other members of the family who may be willing to help, and then talk to them and see if they can assist them. And religious groups are also very useful in this regard. And I think one other useful way is this crèche system, in which elderly people with dementia are taken to a place when other individuals are going to work. Leave them there, there are experts who to look after them. And then when they're closing and coming home, they can then pick them and come home together. It's going to cost a lot. So it's again for those who are affluent and who are able to afford it. It's not for everybody. But otherwise, it can be organized at community level, a kind of support group. And that might be beneficial.
Do we have statistics in Nigeria?
On dementia?
Yeah.
Yes, we've carried out studies. We know the number of people who have dementia. We can calculate it. Amongst the elderly people, we have two big studies. The big one is the one in Ibadan, in which about 3% of those who are above the age of 65 have dementia. So if we have elderly people are accounting for about 4% of the population, so we can then work it out what the number will be. The other study was by Gureji, again in southwest Nigeria, in which you have a prevalence of about 10%. That was much higher. In the northern part of the country, they found the same figure in Zaria. A study in Jos found a prevalence of about 6%, 6.5%. So we have studies from various parts. But because I know our own data, I can swear by that. So I will take it that about 3% of those above the age of 65 might be at risk of dementia. And we know the rate at which they develop dementia as well.
Does the government, Nigerian government, do they have any policy on this?
Yes, the federal government has a policy on the elderly. Ministry of Social Welfare, Sports and something, they have a policy on caring for the elderly. Not dementia per se, but affectations of the elderly, including dementias and co. I think in the last 3 years, efforts have been made to make sure that these documents see the light of day and are implemented. But for now, most of the care is still on the family members.
What kind of pressure do you think it puts on if you have interacted with any child who has a parent who has dementia? What kind of pressure and what are the results and what could that pressure possibly do to the person?
Well, it's a lot of concern. You have an elderly person who is demented, who is not what the person used to be. You're concerned about that. They may also have comorbid conditions that may also bother them. It also disturbs your own activities of daily living because your mind will always go back there. Such individuals need support. I think that's the best one can do for them, not by way of medication, but for them to talk out and seek help and then see how they can be relieved of the burden of looking after the elderly person. When the person with dementia is severely affected, when they cannot look after themselves and they cannot take care of their daily waste, then the stress is a lot more. Because then if we employ somebody, you must be prepared for house helps living from time because they cannot cope with the added stress of doing that. But we get by. And we pray that our individuals will live long, free of disease, and that we can prolong their life before they reach stage of advanced disease.
Professor, thank you so very much. I deeply appreciate this kind of information you have given us and this kind of enlightenment. Thank you so much for your time and for coming all the way. Any fallouts from this, I'll invite you to come back and talk to us.
I will gladly do so.
Thank you so much. Thank you so much. You've heard the causes of dementia and the lifestyle you have to adopt. Alcohol is a no-no if you can, because when you say moderation, who knows what moderation is? Exercising and eating right. We all will age, but I think by the grace of God, we'll all age gracefully and by doing the right things. Putting our trust in God, yes, is one thing, but we also have to do the right things so that we can age gracefully. Thank you very much for your time. You have a good week ahead of you. Goodbye. God bless. And this is my factor.